Welcome, everybody. My name is Dr. Mona Hanna. I'm a pediatrician and a professor at Michigan State University, the Associate Dean for Public Health, and the founder and director of RX Kids. And I am just so excited to be here today with an amazing panel to talk about RX Kids in the Eastern Upper Peninsula. So a little bit of background of what RX Kids is. It is the nation's first mom-baby cash prescription program. It is a bold effort to eliminate maternal infant poverty. This is the time in people's lives when they are the poorest, and it's also the most developmentally vulnerable time. What happens in this brief window of life really shapes your entire life course. So RX Kids is like, hey, we can do better. We can do better at caring for each other. So we're going to boldly buffer families during this sensitive period. So RX Kids provides every mother in an RX Kids community $1,500 in mid-pregnancy. And then once a baby's born, it's $500 a month, and it's for the first 6 months of life here in the Eastern Upper Peninsula. So all of us on this panel were together almost exactly 6 months ago on Valentine's Day. So on Valentine's Day, February 14th, we didn't come in person. My apologies. It was cold in February. We should have came in person, but we're here now. But all of us got together on Valentine's Day to announce the launch of this historic program in these five counties in the Eastern UP, in Chippewa, Luce, Alger, Mackinac, and Schoolcraft. So we celebrated that historic moment. The program launched on March 1st. And we are here today really kind of commemorating the 6-month milestone. We have some of our first babies in the program who have now kind of graduated from the program. So we are here together to mark this milestone and what we hope to continue the program for as long as possible. So this is the first milestone, but we hope to continue for as long as possible. So without further ado, I want to introduce our awesome panel, and then I will be moderating this discussion, and we'll be hearing from all these important people. We have mamas and babies, and we have tribal leaders, and we have health leaders and policymakers, all key components to the success of this program. So I will kind of introduce briefly all these amazing folks next to me, and then we'll go into some questions. We have Haley Stewart, who is a mother from Chippewa County, who is part of the Sault tribe. Her family has received support through RX Kids. They were one of our very first participants. Juliana was born on March 8th, so one of our very first babies that was part of this program here. And she's here to share her experience and the real life impact of the program. And then we have Chairman Austin Lowe's, who is the leader of the Sioux tribe of Chippewa Indians. His vision and leadership helped make RX Kids a reality up here, so we're so grateful for his leadership. And we have my bestie, Senator DeMoose, who represents Michigan's 37th district and has been a vocal advocate for policies that strengthen families and rural communities. And we have Karen Senkis, the health officer for Chippewa County, who brings an understanding of maternal and infant health in the county, the barriers to especially rural health access faced by so many families, and she's been deeply involved in bringing RX Kids here to this region. So let's give a round of applause for our awesome panelists. So I'm going to start by asking them all the same question, and we'll start maybe on the end with Karen. So each of you brings a unique lens to the conversation, be it a parent, a policymaker, a health leader, a tribal leader. Can you share what drew you to RX Kids and what it means to you personally? And we'll start with Karen, and then we'll come down.
Thank you, Dr. Mona. What drew me to RX Kids when I first heard about the program through Dr. Mona and Dr. Luke Schaefer was the fact that there were no requirements other than being pregnant, being a resident of the county or the region that you live in, or having an infant. What I like about that idea is that it applies to everyone then. There are no barriers put in place because of what type of income you have, where you may live in an area, any other household makeup, which again levels the playing field. Everyone is able to access the benefit regardless of who you are. And I just think it was such a great idea that we weren't putting income limits on people or anything like that, which we are used to doing actually in with helping programs. So this was just when I heard about it, I was actually even surprised myself, saying, okay, there's got to be something. Don't we need some paperwork? Don't we need some income something from the participant? But that was really what drew me in.
Thank you. Senator DeMoose.
Yeah, I remember, Dr. Mona, when I first heard about this program, where it was outside of the Capitol, and it was you and Senator John Cherry was there. And at first I thought, wait a second, you want me to support just cash giveaways to people? I'm a Republican here. We don't tend to support these type of things. But the more you talked, the more I realized that this is, in fact, exactly what we stand for. And I have on my desk, I guess this was a personal interest of mine, because I have on my desk on the Senate floor a statue. It's called Homeless Jesus. And it looks like a homeless man sleeping on a park bench. And the only way you know it's Jesus is because there's scars on the hands and the feet. And it's based on a scripture of Matthew 25, which is, whatsoever you do for the least of these brothers and sisters of mine, you do for me. And it's there to remind me not to just always knee-jerk go with my conservative political ideas, that sometimes look deeper. And the bottom line is, we as legislators are tasked with creating the best environment we can, the healthiest environment we can for the most number of our citizens as we can. And so I combine that with the thought of Matthew 25, and literally there's nobody more vulnerable in our society than children and pregnant mothers. This is something we should all celebrate. And the deeper I got into the details of this program, I realized just what a stroke of genius it really is.
Thank you.
My turn, right? All right. So what drew me to this program was the population that it serves. So prior to becoming chairman, I was a clinical social worker, worked with a lot of struggling families, and I knew firsthand how powerful an award like this would have on them. So it's $1,500 during pregnancy, $500 for the first 6 months of life. It totals $4,500. I'm a father myself. I know how expensive it is to raise kids, diapers, cribs, everything. It's so incredibly expensive. And when I was in grad school, we studied a lot about infant mental health and how that basically predicts your life moving forward. And anything we can do to help these people, we're in favor of. So appreciate it.
Awesome. Thank you so much. Haley, what drew you to this program? What does it mean to you personally?
Well, at first I was very, I guess, taken back. I was concerned that it wasn't even going to be real because something like this is just not heard of in our community. But what drew me to the program was I think it was mostly after the Valentine's Day meeting that we had, hearing how passionate everyone here was for this program and how much this program meant to everybody else, knowing that they felt that strongly for moms and the babies that we were bringing into this world. It meant so much to me that somebody could be so passionate about something that didn't impact them. And this program, if it wasn't for it, I wouldn't have had such an easy time with recovery and recuperating, because my husband was able to take time off work, and that was the hugest thing for me. He is the sole provider for our family, and him being able to take some time off and bond with our child was huge for us. So that's what the program means to me.
Thank you so much. So it was not an accident that we announced the launch of this program on Valentine's Day. So you heard about that passion rooted in this program. Yes, we're eliminating poverty for moms and baby. And yes, we are absolutely improving health, and we have that data. But more than all of that, we are sending a message of love, that this is fundamentally how we are supposed to take care of each other. So that's in all of our materials. It's in our pins. It's in our bears. There's a heart everywhere. I only wear red now. But this is, once again, this is a deep passion. And all of us here, like we are in our professions, be it a pediatrician or leaders or policymakers or health, we are in this work for service. We are service-driven people in all of the hats that we wear. And this is exactly one way that we are serving our community. So thank you for that. All right, Haley, I have another question for you. Can you tell us what it was like to receive the first RX Kids payment? And then once again, how has this program impacted your family over the last 6 months? So I think she already received your last payment, right? So she's been part of the program for its entire life course here in the UP. So what was it like to get that first payment, and more, how has it impacted your family?
Getting that first payment was huge because, like I said, my husband was able to take an entire week off of work. And
A week, like that's not enough. Like you took a week off of work.
it was very meaningful because, like I said, again, my husband was able to take that time off, but also we were able to not have to worry about whether we were going to pay our bills or we were going to feed our family. We were able to do both of those and not have to worry about it a single bit. And I was actually able to, with that first payment, have my home cleaned while I was having my baby, and that meant a lot because we had gotten severely sick 2 days before I was supposed to go and have my child, and my husband actually missed the birth of my child because he was so sick. So bringing my child home and knowing that my house was clean, I didn't have to worry about her getting sick. I didn't have to worry about trying to make sure my house was clean for my other kids that I have. Being able to provide that week missed work for my husband also, so that he wasn't concerned and he didn't have to stress, meant that I was less stressed. My husband, like I said, he's the sole provider, and him doing that for the last 7 years has been amazing for me. But being able to stay home with my child and know that my husband also gets that time, he was able to bond with her and show her all that love that, you know, he wasn't able to do in the hospital when I had her. Sorry. This program has just been tremendous. I'm sorry.
Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. So Haley touches on so much of what we are also seeing on a lot of the big data. We see that families spend this money on rent and utilities and food and transportation and baby supplies because babies are so expensive. We also hear a lot about how it is supporting dads, allowing dads to be more part of that birth experience and staying home, and then allowing families to breathe and to have that decrease in stress, and to just be in the moment and to parent. So everything that she shared is also what we are seeing across all of our communities, across the rest of the UP, and all the big data as well. And is Juliana awake now?
Yes.
Oh my goodness, she's so excited. Thank you. All right, Kieran, next question for you. From a public health perspective, what makes a program like RX Kids a valuable tool for reaching families and improving community health?
I think this program does a couple things. First of all, it allows, from community public health, we promote this program through some of the direct programs that we actually deliver, such as women, infants, and children, maternal infant health, immunizations. But we also promote this program community-wide throughout Chippewa County. So we are talking actively to physicians' offices, to our tribal health centers, to community action, to our Head Starts, to our schools, to make sure that anyone who may be in contact with a family that would qualify for this program is aware of the program. That connection then leads to the opportunity to talk about other services that people may have never heard of. Sometimes when you're in a service, when you are a service provider within a community or a region, you can sometimes get tunnel vision where this is the population that we serve, this is how we're going to promote our services. But with this program being accessible to anyone, it opens up that door for us too to promote other people's programs. The feedback that we've gotten as our community health workers go out into the community and promote this program, the feedback we receive is just incredible from other service providers. Physicians' offices will call us if they're running out of cards and brochures. We know that we're getting that RX Kids is getting a lot of referrals, not just from the services that people are coming into our agency to receive, but community-wide. So on that note, in terms of a public health perspective and a healthy community, the more services people are aware of, we look at it like if there are families that are in need of immunizations, maybe they didn't realize where they could go, maybe they weren't sure that their child was due for whatever immunization it may be during that age range. But it just creates, I think, an opportunity for conversation and allows that just that uptake on other services, which creates a healthier community overall.
Thank you, Karen. Karen, can you talk? So, in public health, we talk a lot about social determinants of health, right? So, maybe you can just kind of share with folks like what those are and how this addresses that.
So, in this area, especially, I think one of the issues that families deal with is transportation to appointments in general, to get groceries, to go to the doctor, sometimes even to get to school or Head Start. What this program helps with that cash gift, is transportation directly. I have heard many, many parents say that they are using their money to either get their car fixed, to buy new tires. Someone just told me that the other day, that they were actually able to buy new tires for their car. So we may not look at it, we may not see the big picture yet, but I think when we can address those social determinants of health by filling the gap so that people have more access, better access to food, can get to those appointments, can do other things with their families that they may not be able to do because they didn't have gas money or their car wasn't working. They didn't feel comfortable driving more than 30 miles. All of those things are just so important to families.
Thank you. So I think we often confuse health with health care. So I'm a pediatrician. I provide direct one-on-one health care. But healthcare, medicine only contributes to about like 10 to 15% of health outcomes. It's those social determinants of health, whether you grow up in poverty, if you have transportation, clean air, clean water, all these other things that play a much greater role in making sure our babies grow up healthy and successful. So the neat thing about RX Kids is that we are proactively treating, almost like an immunization. We're preventing one of the most kind of pathogenic social determinants of health, which is poverty. I also want to touch a little bit on transportation. So in the UP and in our other sites, mamas enrolled in the program, 50% of them, after they enroll in the program, have an economic shock. So there's something like a crisis that they have to pay like a big amount of money for. And by and large, the greatest economic shock is in transportation. It's auto related. So a lot of families, and here more than anywhere else, you need reliable transportation to make sure that you can be healthy and meet your family's needs. Right, Juliana? I know, right? I know. You hear me? I know. Okay. All right, Chairman Lowe's, you have been an incredible champion for this program. You were in Lansing last week and you testified at a Senate hearing about the program. This means kind of so much to the community and to all of us. So why did you choose to make RX Kids a priority? Like, what moved you to act? And what do you think makes this model especially powerful for your community?
I appreciate the question. So why I chose to make this a priority is because the population it deals with, we're talking about young families and we're talking about making pregnancy and postpartum less stressful. So as I mentioned, it's incredibly expensive to raise kids. And if you can take away some of that stress to have families just be able to enjoy their new babies at home, that's something we're incredibly supportive of.
Awesome. So one thing I loved that you shared during the Senate hearing was this concept of 7 generations. Can you talk about that a little bit?
Yeah, so in the Sioux tribe and a lot of Native American communities, we talk about 7 generations. And the concept of that is to leave the next 7 generations in a better place than the current one is. So investing in our children is just a simple investment in our youth, and it's so crucially important. And it does make the next 7 generations better than this one.
Yeah, I love that so much. And I wish that all of our policies and our practices and our investments follow that. We often are quite short-sighted in what we do, be it with environmental regulations or investments in children or education. We fail to consider even one generation. So it would be wonderful if we all kept that mindset. So thank you so much. Senator DeMoose, how do you see RX Kids aligning with broader goals around family well-being and rural opportunity?
Well, I'll tell you what, I go back to, we had that great hearing last week in the Senate. And I think I started my question by saying, you had me at baby parades. Because this idea of a baby parade like you've done in Flint, and we haven't done one up here yet.
There was a very little one, yes. There
okay, next time I want to come, because I love this concept of celebrating families and children and babies. I mean, I deal in my line of work, every legislator deals all day long with bad news. And this is undeniably good news. And so and I love how it brings people together.
Yeah.
I mean, look at what you have even right here. You have a state legislator representing the state of Michigan and an agency person, a health department. You've got a sovereign nation here who's all in. You've got mothers. You look around, this can bring all kinds of people together. And what I think you were asking about how it accomplishes some of our goals from a policymaker standpoint is this literally addresses a huge number of things we're dealing with every single day, whether it's health policy, safety, whether it's the economy, whether it's education, whether it's looking out for the future of our families and the future of our state and population growth and these type of things. This program literally touches all of that, and it's structured so beautifully in that it's totally efficient. There's almost no overhead. What I've told people is that one of the things I love most about this is it is that private-public partnership where I might have the math wrong, but based on the numbers I've seen, it almost looks like it's for every dollar the state of Michigan is spending, another $5 are coming from somewhere else. This is the type of solution we're looking for, so that it can't all come from the state's treasury, which is constantly under pressure here. So from a policymaker standpoint, I think it really helps us address things that we're always looking for solutions on.
Yeah, I would just echo that. This is a public-private partnership. You have a university, you have all these different kinds of players coming together, like working hand in hand to solve these intersectional issues. When you solve poverty, this big problem of poverty, you are solving the poly crisis of housing and childcare and maternal infant health and equity and birth death. The list goes on and on of what you're able to solve when you can solve a root cause issue. And I think because of that, we've been able to engage with so many unexpected partners and folks who all care about these same things. And and also the different funders and foundations and policymakers, like, I wanted to, like in Flint, for example, in our data, we had no evictions last year among low-income mamas, and there's all these folks trying to help with housing stability, and we had improved nutrition security, and we had a decrease in postpartum depression, and so it's solving all of these different things by one simple intervention.
Well, can I jump in
Yeah, of
on
course.
that? Just one more policy thing is I'm pitching this to some of my colleagues as a cost saving measure for the long term, because it's so apparent that first few months before you give birth and those first few months after you give birth are so critical in the life of a child and in the life of a family. And if we get that time period wrong, it causes problems that the state ends up paying for and society ends up paying for the rest of that kid's life potentially. So this is really, it's pay me now or pay me later in a way.
Yeah.
And if we can help out in those moments, I think it saves us money in the long term as a state.
Thank you for mentioning that. So the data that we've already seen from ARC's kids implemented, and especially in Flint where it's been the longest, but also really based on decades of global and domestic data, show that cost savings. And so often when we talk about cost savings for children, we talk about the long term. We talk about education and better health in the future. But we're actually seeing short-term cost savings. So let me just kind of touch on those real quickly. So we are seeing a massive increase in prenatal care use. Mamas are coming into prenatal care earlier and they're going more often. Because of that, we're increasing the detection of pregnancy-related conditions like gestational diabetes and gestational hypertension. Because those things are being caught earlier, moms are getting treated, and babies are being born more on time. So we have less premature babies and we have less low birth weight babies. And because of all that, we have less NICU admissions, which means having a baby stay in the neonatal intensive care unit. So these are things that we're already seeing, and we can right now translate those into cost savings. So if we extrapolate that just to the state of Michigan, we would save about $500 million a year just on those acute birth outcomes improvements that we're already seeing. So this is not something like wait and see, wait 20, 30 years, and we'll get cost savings and different budgets like special education or criminal justice. We are seeing the cost savings right now. I'll share another bit of cost savings. savings that is happening right now, and that's around child welfare. So child welfare is kind of the involvement in the child protective services system. The peak age of child welfare involvement is the first year of life. It's more than double any other age, and that's largely because of that economic hardship, the economic instability in that first year of life. Families can't keep the utilities on because of all these added costs, or the baby is dirty, or what have you, and that Child Protective Services is called. They do an investigation. It's traumatic for the family, and sometimes they take a baby out of that home, and then we as a society often have to pay for foster care until the age of 18. We are preventing child welfare involvement. Already in our data, we are seeing about a 20 to 30% decrease in child welfare involvement. That is a massive cost savings. It's estimated to have a 1 to 4 return on investment. I'll mention one more cost savings before we go back into the panel. The problem with having a moderator is I talk a lot, so I talk too much. The other kind of cost benefit of this program is the local economic stimulus. So this can be seen as a trickle-up program. So our inaugural funder of the whole program was the Mott Foundation in Flint, Michigan. They actually committed $15 million to the program, which is amazing. But they said, even if you don't do what you say you're going to do with improvements in health and eliminating poverty, that's money that's going to go right back into our local economy. So that is money that's going to be spent locally to pay landlords, to support small businesses, grocery stores, for mamas to buy diapers and cribs and what have you. So the Flint Chamber of Commerce released a report a few months ago that talk about the economic stimulus of this program. Every dollar in a cash prescription is bringing back another more than $1.50 into the local economy. And these are local economies like here that need economic stimulus. So that's another benefit of this program, where you don't have to wait and see the long-term kind of outcomes. You see that today. All right, I will go on to my next question, and you can tell me to stop talking at any time. Karen, so how do you see cash supports intersecting with other maternal and infant health programs in the county? You mentioned this. What indicators or changes will you be watching over the next few months to years to understand the impact of RX Kids in Chippewa County?
So yes, I did kind of jump ahead and mentioned the intersection earlier with some of the maternal infant health programs such as Head Start and physicians' offices and schools. But one thing I didn't mention was the connection to community mental health or mental health providers, behavioral health providers. One of the things that we see a lot in our office, and I know a lot of physicians' offices see, is that postpartum depression. Sometimes that depression can creep in even during that last few weeks of pregnancy. And I think Haley hit the nail on the head when she said that she just felt like she could relax a little bit, that she didn't have to worry as much about her husband going off to work, her having to go to work sooner. That all plays into the mental health of the mom and the mental health of the father, the mental health of the whole household. So if we can do something as a community to make sure that we're trying to address that, as Dr. Mona said early on, to prevent things that might happen down the line, that's huge. It's just huge. And the importance of being able to talk about what postpartum depression is or those struggles immediately after that child is born or leading up to it is just something that we need to make normal. We just need to keep talking about it. What we'll be looking at in terms of indicators or changes, every 3 years, our entire region of the Upper Peninsula, the health departments get together and we do a community health needs assessment across the region. So what we'll be looking for is better access to care as a pregnant person, as a new family, making sure that mom and baby are getting the health care that they need. And again, this is where this cash gift plays in to this role, is making sure people can get to appointments when they need them. Where we're located in Sault Ste. Marie, the closest NICU is either Marquette, which is 3 hours away, or Petoskey. So you're traveling for that enhanced service if that's what you need. Delivery hospitals. Sault Ste. Marie is a delivery hospital, and then Petoskey, and I think Marquette is the next one. So again, you're looking at a distance here. If you run into any kind of trouble with that delivery or with that pregnancy, you are traveling for that care. So we're going to be looking for an increased access to health care. We're going to be looking for healthier outcomes of newborns, hopefully less hospitalizations in the NICU, and overall better access to health and just overall, oh, I lost my train of thought, but that's what we'll be looking for, those health outcomes with pregnant women and babies primarily.
Thank you. So something that you touched on earlier, when people participate in ARCS Kids, they tend to then have a higher take up of other programs. There's a trust that is built that allows them to maybe have more bandwidth, more time, more interest in taking up things like WIC or a home visiting program. Something in our research that we already noticed is documented increased trust both in government and in healthcare. So this is kind of one of my favorite findings so far, kind of maybe a little bit of an unexpected finding, but we see RX Kids as almost kind of a reimagination of the social contract, which is this relationship that individuals should have with government institutions and healthcare. And the more of trust that you have and more faith in these institutions, the more likely you are to, for example, be civically engaged, or or go to different appointments, or take up another program because you trust that institution because they also told you about this program. So that's something that we are seeing in kind of the early data, is an increased take up in other things because of this, but also more trust in institutions. Senator Moose, what gives you hope, even in the face of challenges, about what's happening here in Michigan?
Well, I'll tell you what, this program gives me a lot of hope for a number of different reasons along different fronts. I mean, one, we live in a society that's literally being pulled apart, it seems, with conflict. And it doesn't matter what level of society you're talking about, just look at what your government, at the local level, at the state level, at the national level, it's sort of all conflict all the time. And so I like it from that little standpoint of this brings people together. I mean, what better to rally around than kids, and babies. You got it right there. It gives me hope how you've structured this whole program to be so efficient. Like we said, bring other outside funding in, but even the little nuances that are so thoughtful on this, like not having means testing. I mean, this is critical because one of the goals is to remove the stigma of needing a little extra help. And so many programs the government comes up with, you have to prove that you need it. You have to sort of sneak in and be embarrassed. Well, I'm the guy who needs the free lunch, or I need this. And you shouldn't be embarrassed. But this program just says, forget it. This is for everybody. And I think that helps. And I think it's hopeful because of the way you're treating that, because it also recognizes that not just a lot of people who wouldn't qualify for other assistance are still struggling
100%
under this inflation. But the biggest thing that gives me hope, I guess, is that this is something that actually works. So much of what we pursue, you don't know, and you won't know for years and years, was this a good idea? Was it a bad idea? Was this money well spent, or what did it end up not doing what we thought? You know this right away by looking at the families right away. And this was highlighted this morning. Somebody was asking me about trying to get this program in another city here, and what happens if, we can't get it past those initial 4 years. I guess they're looking at a 4-year program. And I said, well, hopefully we will. And we're going to stick to this. And I believe success breeds success. So when people see how well it works in the first 4 years in their city, they'll want to keep going with it. But even if they don't, you can't take away what happened in those first 4 years with those families and those babies who were helped. So no matter what, what we're doing is going to make a difference to some people. And that gives me a lot of hope.
Oh, awesome. Chairman Lowe's, it seems like you want to say something.
Oh, I mean, I could talk all day about this program, to be honest with you. So, I mean, one of the big things that we were so in favor of was that there's no strings attached with this. You don't have to prove income. Everyone qualifies, and it's so incredibly easy to sign up for this program. So I had a conversation with Haley this morning, and she said that she signed up for this program on her iPhone 3 hours after she gave birth, and it only took an hour to complete the application, only took 10 minutes to gather the documents, and then within 24 hours, she had a direct deposit of $1,500.
That's amazing.
Working in social work, connecting people with resources in this community year after year, there's no program like this. There's no program like this. And do you have the statistics for how many Native American families have benefited from this in the 5 counties up here?
Yeah, 25%.
25%. That's absolutely incredible.
Yeah, so check our website, rxkids.org. Every week, the numbers get updated. So we have hundreds of families. Amanda, tell me, how many families here? I think 300.
323 families and 189 babies have been born.
Okay, so 323 mamas and families have enrolled in the program, and of those, many are still pregnant. So almost 200 babies have been born. You can see the demographic data, you can see the income data, but about 25% of those babies are Native American babies.
And then the last thing I want to share, and this is something I learned from speaking with you, is that this program has a MOU with the state of Michigan, so you're able to monitor how many kids are born in each county. This program is almost utilized at 100%. Comparatively with WIC, that's utilized at about 50%, and for home visits for parents that bring their kids home, that's about 25%. So people are using this program. They
Yeah.
really are.
Yeah, so our take-up rate in all of our communities so far is about a 98%. The longer we're in a community, the higher the take-up rate. And that, to me, as a public health person, a doctor who's been spending her whole career trying to get people to sign up for things, it's been just eye-opening. When you develop something that's easy to administer, that's easy to access, that's communicated in ways with dignity and not shame. This is not something for poor people. You didn't do something wrong. This is for everybody. Because of all those things, it's a highly popular program, and we are able to achieve that almost full saturation rate, which is phenomenal. And this was purposeful. We designed this to be a place-based program. And when you do something for everyone in a community, once again, you're telling mamas and families that everybody is worth it, that we see you and hear you and you're all important, and there's a village of all kinds of folks and agencies and organizations that are standing alongside you during this really critical window. So it conveys that dignity. The universality conveys dignity and love, and then the no strings attached. We're not telling people what to spend their money on. We're not policing them. This is not paternalistic. That conveys trust. We trust our families to do what's best, because mamas, families, they know what is best. They don't need people saying, spend on this and spend on this, spend on this. There is no better wise person to know what the family needs than the own family. So that empowers families. It gives them the flexibility. Some people need help with diapers, but some people need help with rent. And some people are okay with rent, but they need help with food. And some people are okay with food, but they need help with transportation. So this flexibility gives people the freedom and choice. And that freedom and choice, that's why cash transfers have historically been championed by libertarians, because of kind of its small government, very kind of laissez-faire approach to this work. Just give people unconditional cash. Don't create these complicated bureaucracies to help people. So that question was about hope, and I would be remiss if I did not share that in the last couple of weeks, we released our newest RX Kids bear. So this was our original RX Kids bear named Rex, get a RX, Rex. And then this was our second RX Kids bear named Luna. But when we launched Clare County a couple weeks ago, we felt that they needed a little bit of hope. So this is Hope. So this bear is named Hope, and it kind of coincided with the launch of RX Kids in Clare County. And we're going to make sure that Juliana gets Bear Hope. Oh, okay. All right, we're gonna wrap up soon. So this is a question for everybody. So if you had the microphone for 1 minute, and you can actually spend more than 1 minute, to speak to other cities or states or tribal nations, what would you say about why they should consider launching a program like RX Kids? And I would just add that, we now spend so much of our time working with so many other communities across the nation. So right now, RX Kids is in 9 Michigan communities. In a couple months, we're going to be in 8 more Michigan communities, mainly around Southeast Michigan. So almost doubling the program here in Michigan. But we are also talking to Mississippi and Arkansas and Nebraska and Tennessee and Maryland and Alaska and Hawaii and Oregon and New Mexico and Washington. We're talking to folks all over who see that this as an answer, a plug-and-play program that was already created, that within months can also launch in their communities and solve all these kind of intersectional issues as well. So once again, if you had a chance to talk to other places, and many of you have actually already done that, what would you say to them? Haley, do you want to start? And we'll go this way.
Sure.
If you could talk to other mamas and other places.
So
And I'll take Juliana, just so you have full attention.
So if I could say something to other people in order to encourage this program, I honestly would mention one of my really good friends who ended up in the NICU, and like Karen mentioned, the closest NICU to our area is 3 hours away. So that means 3 hours worth of drive time there, 3 hours back. If you, like my friend had her child 9 weeks early, and he had to be transported over to the NICU, again, 3 hours away. That means that funds that she got went towards bills that she couldn't pay because her husband had to be with her, transporting her after an emergency C-section. They were able to pay for all of the funding to drive back and forth, any food that they needed. They have 2 other children outside of the child that needed the care in the NICU. And they were able to do everything that they needed to do, take any time off work that they needed to in order to make sure that all of the needs were met across the board, whether that's at their house or in the NICU with their child, or for school, even for these other children that they had, because it was during school that she had her child. Things like that in a community that's small like this means so much. And again, if it wasn't for this program, so many more people would be impacted negatively in the area just because of the smallness of the community. And there's so much. Our winter is like 9 months long up here, honestly. Really? Oh, it's a real long time. And there's some businesses that actually have to close for the winter because they don't have the means to stay open. They're not in the right location to be able to stay open all year round and things like that. And that means that they lose that income for 9 months. And if they have any children in their family, they're down to one or no income. And the impact that makes on them, it's just outstanding. I'm sorry. This program truly is just something that I think needs to be everywhere and available to anyone. It's impacted my family so greatly and my friends so greatly. It's amazing.
Thank you. Chairman Lowe's, what would you say?
So I also agree that this program should be everywhere. I don't think it should be isolated to the 5 counties up here. I don't think it should be isolated to Flint, Kalamazoo, but that requires different community partners coming together, providing funding for this program, which my tribe was so willing to do. We have one of our council members here that voted to support it. You know, he wasn't the only one. I believe it was unanimous, because why wouldn't you support babies? Why wouldn't you support your future? This program doesn't require income requirements, so you know, all families benefit. It's no strings attached, and it gives the families the discretion and the respect to figure out what their families need, whether it's help with rent, whether it's help with fixing their vehicle, diapers, you name it. You know, it helps so many people, and we're so grateful for it.
Thank you.
Well, I guess I have a similar answer to what Chairman Lowe's was saying, because why wouldn't you do this? I mean, it doesn't matter what position you're in. This is literally our job of anybody in any leadership position to try to bring good things to help their communities. And this is undeniably good for the members of your community. I mean, this is the type of thing we as legislators look for, is how can I bring money and put it into the hands of my constituents who are struggling. This is great. But I think one of the things that I would say to somebody considering this, because I could see them thinking, how do we even get started? And this is so complicated. And all I can say is, based on having seen how this works, that the minute you or your community decide that you want to do this, you're going to have Dr. Mona bounding through your door screaming, I love babies. I'm here to help. And you're going to have every legislator thinking, yeah, how can I help? Because this does exactly what I've been sent to Lansing or wherever, or Washington for. All manner of help. Every corporation, you're going to get great sponsorships, because what better to market your brand than to be seen as helping babies? So don't be scared off by what might look like a daunting process. The minute you say in your community that you want this, all measure of help is going to come to you, because we all want to see this happen all around the state.
I'm not sure if I can add any more to what everyone has said, other than it's a no-brainer, and why wouldn't you implement something that helps everyone, that helps the entire community? And we're already seeing an impact that is probably just going to be built on as we move through this, hopefully, and expand it. And just to keep in mind, we never know where someone is. You know, we can think that we think a family's doing well because of the house that they live in and the car that they drive, but you never really know what they may be struggling with. And I think that's the beauty of this program, is that everyone can benefit from it. So.
Aw, thank you so much. Thank you, thank you, thank you. Juliana, do you have anything to say? She's been like talking up what's going on over here. Like, oh, she's so happy. She's like, on behalf of all the babies, thank you for your support. Thank you for your partnership. Thank you to the Sioux Tribe for hosting us here today. Thank you, all the leaders who made this possible. This is the why, right? This is why we are here. This is why we do this work, for her and for the thousands of babies just like her who deserve to have the brightest, healthiest future possible. So on behalf of all the babies, say thank you. Thank you so much. I appreciate all of you. All right, so I am going to pass it over to Chairman Lowe's now.
Closing remarks? Is that what it is?
What, closing remarks and then a presentation or something else?
Okay. Well, like I said, it's been an absolute pleasure to work with you. We highly value this partnership. It's helped so many tribal families. Like you said, out of the population that's been served in the Upper Peninsula, 25% has been Native American. So we appreciate everything. And we have a present for you.
Oh my gosh, you have a present for the babies.
No. Are we doing the check presentation?
Yeah.
Sure. Okay. Put 'em like.
All right.
Yes.
You mind if we wait just a second for our CEO? So you can come
Yeah.
on up,
Well, okay, we'll do something else, but
Okay.
then we have something else to do.
Okay. All right.
We don't see it. Wait. Okay, so Senator DeMoose talked about the joy and the celebration. We have baby parades. We had a lovely brunch and a tea party yesterday with mamas. We are also actively shifting the narrative to love and to celebration for our families. So every baby that's born in an ARCS Kids community, and we have a data use agreement with birth certificates, so we know all the babies that are born in an ARCS Kids community. So every baby gets this welcome packet in the mail, and it includes a personalized card. Did you guys get one of these? Yeah, like welcome, baby Juliana. We are so happy you are born. It says sign up for the program if you haven't, but over 90% of folks sign up in pregnancy. It also directs them to resources. It has a really cute quote from Magic Johnson that says, and a Spartan Michigander, all kids need a little help, a little hope, and somebody who believes in them. They also get a card from the governor of Michigan that says, welcome to our newest Michigander. We are so happy you are born. We cannot wait to see what you become. This also a very deliberate attempt to kind of renew that social contract. And then every baby gets these really cute onesies. One that says best baby ever. And then one that says love. So this is kind of our unofficial kind of logo as well. You see some folks with shirts that say love. And it has these arms like almost hugging, and this kind of symbolically shows that this is like a whole community that's coming together to hug our families. So we've in gratitude to the Sioux Tribe, we present you with a framed onesie.
Oh,
So it's that love onesie.
Can we get on this side over
Yeah,
there?
why don't you come on over? Senator Dumas already has one. Karen already has one. Yeah.
Well,
So
where's the parade?
yeah. So as a reminder of the baby and the love. Yay! Oh my goodness. Yay. Awesome.
You ready for your
Yes, we're ready. Really good at stalling.
It's money.
Oh my gosh, that's funny.
200K.
200K. Oh my goodness. This is amazing. Come on. Wow. Wow. Whoa. Wow. Love the text. Goes back to baby. Yay. Thank you so much.
It's like a round of applause, is it, right?
Thank you so much. Oh.
So for your office.
Oh.
was actually made by a Sioux tribe member who's actually a boarding school survivor. So yeah, she makes those, and we give them to a lot of people that we have partnerships with.
Thank you.
Before we wrap into our pictures, we have a few questions from the media.
Yes. Let's come back to our spots and answer any questions from the media. Okay, go ahead, Josh. You can share those.
The main question is if you could provide an update on the expansion of the program in other cities, when and where.
Yeah, so the question was, can I provide an update on the expansion to other cities? So like I said, we're in 9 communities right now. The last expansion was in Clare County, which launched on August 1st. Tentatively on September, we are launching 2 communities in Oakland County, Hazel Park and Royal Oak Township. We've already launched in Pontiac and Oakland County, so then that covers the 3 kind of greatest need communities in Oakland County. And then in September and October, we will be launching in 6 communities in Wayne County. And we are waiting for Wayne County Commission to have a meeting, and then we'll be able to share the names of those communities. And we're also closely working with the city of Ypsilanti and the city of Saginaw that have raised some money, but not enough money to launch the program. So always looking for more big checks.
I see no other hands raised, but this would be the final time to ask questions if you're.
Do we have some folks here or any other questions? All right, let's give a round of applause to our awesome panelists. Thank you, everybody.
Sorry, one more.
Oh.
Kate Wells, go ahead if you want to unmute. Or ask, quite curious, does the state budget uncertainty impact the TANF dollars?
TANF dollars. So Kate Wells from Michigan Public Radio is asking if the state budget uncertainty impacts the program or TANF or whatever.
Well, are you asking me? I'm assuming.
Yeah.
Since I'm on appropriations committee. Yeah. Well, I think the state budget dispute or chaos affects everything, frankly, right now. Because, and I will tell you that I believe it's absolutely irresponsible. We had a deadline of getting this done by July 1st. We haven't done that. We are lawmakers, and that's a law, so we've broken the law. The bottom line is we need to break this impasse. And so my biggest hope, the biggest thing I'm supporting in this year's budget is continuing this program. I don't believe that we're going to get all that we're looking for, which is to roll this out statewide this year. But as long as we can continue to support it, this is something that's, it's a matter of what are the priorities of the state. And to me, this is a real priority.
Thank you. Thank you. Thank you.
Headed back home? Yeah, well, let's say this first and then head it back.
Oh, yeah.
What are you doing sitting?
We're going to stop by. Oh, this is